Okay, I think we'll get started. Hello, everyone, and welcome to this Peace Talks webinar from the Political Settlements Research Programme. My name is Allyson Doby. I'm the Communications Officer for PSRP based at Edinburgh Law School. Today, we have Kathryn Nash and Hannah Den Boer presenting from PSRP to offer early insights into how regional intergovernmental organisations are responding to the COVID-19 pandemic. So just to let you know, before we get started, we are recording the presentation element of this webinar, but not the questions and discussion. And we will post the video on our website and social media channels after it's been edited. In the event, please keep your microphones on mute. You are welcome to leave your video on if you wish, as it's always nice for the presenters to see real life people in the audience. The chat will remain open throughout, and there's a few key links already posted. So if you have a question or a comment, please feel free to pop it into the chat box at any time, and we'll save them up for the second half. Now to introduce our speakers. Dr. Kathryn Nash is a postdoctoral research fellow with the Political Settlements Research Programme at the University of Edinburgh Law School. She completed her PhD at the School of Oriental and African Studies, University of London. Her research focuses on norms, the role of regions in the international community, and peace and security issues. Her book, African Peace, Regional Norms from the Organisation of African Unity to the African Union, was recently published by Manchester University Press. And we also have with us today Hannah Den Boer, who is a research consultant. She completed an MSc in International Development at the University of Edinburgh in 2019. After her graduation, she's assisted in multiple research projects at the University of Edinburgh. Currently, she is doing research for two COVID-19 research projects, one of which is led by Dr. Kathryn Nash, on responses by intergovernmental organizations to the COVID-19 outbreak. So without further ado, I'll hand over to our speakers. Kathryn, over to you.
Thank you, and thanks everyone so much for being here. So just to kind of first set out some wider information on the project. There are many projects that are underway to understand the impact of and response to the COVID-19 pandemic. Many of them are looking at state or global levels. And the project that Hannah and I are working on investigates the response of regional organizations to the COVID-19 pandemic with a focus on Africa, Latin America, the Middle East, and South and Southeast Asia. We've gathered primary source documents, so communiques, briefings, press releases from major intergovernmental organizations in the regions. And at times we've found particular organizations are more active in the response than others, in which case we've focused our data collection on those. At this stage in the project, we're mapping responses and doing an initial analysis to compare responses across regions. And we rely on information from the organizations themselves and have not yet delved into the effectiveness of these responses or the geopolitics that might have shaped them. However, a second stage of the project is currently underway and will be examining the impact of regional support on member state responses in a select number of cases in Africa. We just don't yet have much data to share on that stage of the project, but we have a lot of questions we're exploring, and we're seeing some trends that we think are going to very much be worthy of investigation in terms of how they're going to shape regional and global governance in the years to come. So with that, I'll start with looking at the African Union and Africa Centers for Disease Control and Prevention. And the continental response in Africa has been led by these organizations. The African Union is the continental body, and its specialized health institute, the Centers for Disease Control and Prevention, or Africa CDC, was only formally established in January 2016 and then launched 1 year later. The guiding framework for the response has been the Africa Joint Continental Strategy, which was released on March 5th of 2020. However, the Africa CDC stood up its health response far before March. Its Incident Management System and Emergency Operations Center for COVID-19 were activated on the 27th of January, and the first confirmed case in Africa was in Egypt in mid-February. The Joint Continental Strategy highlights 6 focus areas for the response: surveillance, infection prevention and control, clinical support, laboratory diagnosis, communications, and medical supply procurement. And responding in these focus areas has entailed a range of responses. For example, one surveillance Africa CDC ran in collaboration with the World Health Organization was a training of trainers events across member states to enhance surveillance for COVID-19 at points of entry. And to support laboratory diagnosis early on in the pandemic, Africa CDC reported that member states had been trained in laboratory confirmation of COVID-19 and that all laboratories had received startup kits after the training. On communications, Africa CDC has produced materials for the general public and healthcare workers, and part of the second stage of our project is going to be trying to understand how these materials were utilized by member states and the extent to which they were trusted and taken on board by the public. It's also held a number of virtual training events, ranging from discussions on diagnostics to mental health aspects of the COVID-19 pandemic, and it's launched projects in communications with partners to counter misinformation. As the vaccines began to emerge, Africa CDC then issued guidance on expedited regulatory authorization for the emergency use of COVID-19 vaccines. And the African Union has been significantly involved in pushing for access to the vaccine for all states. For example, in December 2020, the African Union convened high-level actors from member states and from the Secretariat of the African Union to discuss a framework for fair, equitable, and timely allocation of COVID-19 vaccines. In addition to all this work, the African Union and Africa CDC are also seeking to enhance the capacity of the region to respond to future public health crises. So, for example, they've been supporting initiatives to enhance laboratory capacity and the capacity to produce PPE in Africa. So these are the things that are going to have, I think, ramifications for future responses, for future public health crises, and for other complex challenges that are really going to be worth exploring after we do this initial mapping of figuring out what's going on. There's, also another piece where the African Union and the Africa CDC is just one piece of a very complex puzzle with other actors across governance levels and from local to international, marshaling responses to a crisis that has, of course, transcended governance boundaries and physical borders. There is, of course, the World Health Organization, which has the regional office for Africa, and Ghana and a few other countries have just received the first doses of COVID-19 vaccines through the COVAX scheme, which is convened by the World Health Organization and other partners. And Africa CDC has been the recipient of significant in-kind and financial support from bilateral partners, global organizations, and private foundations for its ongoing work to respond to COVID-19 and other health crises. There's also been responses at the sub-regional level. So the Africa CDC has something called regional collaborating centers across 5 sub-regions. But how active these regional collaborating centers are and the extent to which the Africa CDC collaborates with previously established sub-regional health bodies varies significantly. There are also sub-regional organizations. One of the most established bodies is the Economic Community of West African States in the West African sub-region, and it's been active in this crisis and tracking cases. So it has its own West African Health Organization, which was created far before Africa CDC in July 1987. And in response to the COVID-19 crisis, ECOWAS, the Economic Community of West African States, and the West African Health Organization have been active in establishing communication platforms, distributing supplies to their specific sub-regional member states, finalizing a regional strategic plan, and raising funds for the response effort. They've also been working with Africa CDC, particularly on support for laboratories. So in responding to the COVID-19 pandemic, there has undoubtedly been a growth in the capacity of Africa CDC and potentially sub-regional organizations. Africa CDC has attracted substantial funding and public exposure, as well as developed its own internal structures, including these regional collaborating centers. And while the pandemic response provides some indicators of collaboration with global and sub-regional bodies, how this collaboration plays out over time is very much an open question. And notably, will there be a shift in the ownership of public health initiatives, or the authority of institutions? Will regional organizations become more trusted than international health bodies to respond to public health crises? And what does this tell us about legitimacy? So I think there's a lot there in terms of how these organizations have worked together, if there's going to be future division of labor, and how the capacity that's been built through this pandemic is what is going to mean for kind of governance in various spheres. Finally, I'll touch on kind of the political aspects of the response to COVID-19 through the African Union. So the African Union has spearheaded additional initiatives to support the continental response and address the wider ramifications of the COVID-19 crisis. For example, there's the AU COVID-19 Response Fund, which was launched in March 2020, and the fund supports procurement of critical medical supplies that are then distributed by Africa CDC, and the funds will also be used to mitigate socioeconomic and humanitarian crises that are brought on by the pandemic. The AU has used its continental convening power and relationships with other intergovernmental organizations to advocate on issues that the COVID-19 pandemic has exacerbated. For instance, a communique from June of the African Union Peace and Security Council highlighted protectionist policies that restrict the access of developing countries to crucial medical supplies and called on the World Health Organization to help ensure access to these supplies. The African Union have also pushed for debt relief to help African states develop the necessary resources to fight against the pandemic and its wider impacts. And this is part of, I think, a wider push by the African Union to highlight inequities in the international system that have really been exacerbated throughout this crisis. And going forward, I'm interested not only in how African institutions evolve as a result of COVID-19, but how African diplomacy might be used to push global governance to evolve. Will there be a renewed framework for equitable access to medical supplies? And/or will regions go the route of developing more regional capacity to produce medical supplies and medicines within their own regions? In addition, we know, of course, that COVID-19 has touched on many other aspects of governance and life. And the African Union has marshaled parts of its peace and security architecture to respond to the pandemic. The Africa CDC and Operations Division of the AU Peace and Security Department deployed 28 responders to several member states through the African Union Strategic Lift Capacity. And this was done in line with Article 6 of the Peace and Security Protocol that lists the functions of the African Peace and Security Architecture as humanitarian action and disaster management. The African Union has recognized that the pandemic is changing conflict and conflict management on the continent. And there are recent reports on conflicts in the Sahel and Horn that have highlighted how the pandemic has become a recruitment tool for extremist groups and the potential impact on funding for future peace missions. However, there are opportunities too. So there's the potential to use digital technologies for peace processes and implementation, and also for expanding the remit of the African peace and security architecture in innovative ways like I just described. So I think it's worth asking questions around how these practices and how the impacts of the pandemic will impact things like peace and security or many other issues. For example, will peace process negotiations and monitoring potentially be held over Zoom or use other digital technologies? Does this have the potential to increase participation of different groups, or will a lack of in-person interaction damage the potential to find common ground? Practices that have emerged in response to the pandemic and the adaptation of these intergovernmental structures are going to have major ramifications for future practices. So overall, just to conclude, the pandemic has clearly prompted a massive public health and political response from African regional organizations, and the impact of this response on global governance and on regional governance is going to be an open question for scholars. The information I've presented is available in a blog that Allyson has been sharing, and there'll be further reports and updated information with regional comparisons that'll be forthcoming this spring. Additionally, our work to understand the impact of African Union response and support on member states, which is done in partnership with AmRef International University in Kenya, will be forthcoming later this year. So thank you so much, and I'll turn it over to Hannah and then look forward to a discussion and questions.
Hello, everyone. Thanks, PSRP, first and foremost, for organizing this. And thanks to everyone participating. I'm Hannah Boer, and I'm currently assisting Kathryn Nash in her research on regional responses to the pandemic. My part of the research is concerned with analyzing regional organizations in Latin America and in the MENA region, in Middle East and North African region. And I did this by collecting press releases and documents published by the organizations to fully understand the kinds of coordination efforts which make up the responses. Today, I will cover the responses of 3 organizations in the Americas, Mercosur, and the Central American Integration System, SICA. And in the MENA region, the Organization of Islamic Cooperation. Strictly speaking, the Organization of Islamic Cooperation, the OIC, is not necessarily a MENA regional organization, as it covers 57 member states over 4 continents. However, the OIC is considered a MENA regional organization in much of the literature, as a majority of the members are MENA countries. Everything I refer to in this talk can be found in blog posts and a report Kathryn and I are currently writing for the Political Settlements Research Program, which will be published soon. But of course, in the meantime, you can always reach out to me for documents or questions or anything. So Latin America is a very dense space for regionalism. There are 13 regional and sub-regional organizations in total, some also with overlapping memberships. And each of them was created in different eras, has different policy interests, and therefore pursues different agendas in the future of the bloc. And during the pandemic, there were several regional organizations that have been active to different extent in responding to the COVID-19 crisis. So I'll take you through the efforts by the largest intergovernmental organizations in South America, Mercosur, and the most active organization in Central America, SICA. Mercosur was created in 1991 to promote free trade and the fluid movement of goods, capital, and people among its member states of Argentina, Brazil, Paraguay, and Uruguay. And in response to COVID-19, Mercosur's first regional efforts were coordinated in March by the leaders of the bloc. And these efforts pretty much reflect the organization's values of unhindered circulation of goods and services. So the organization instructed the member states to speed up transport channels for essential goods, facilitate repatriation, and to evaluate the possibility of lowering tariffs on goods destined for disease prevention and healthcare. In early April, Mercosur approved a security fund of $16 million for scientific research in the area of regional public health by research institutions throughout the bloc. And this fund is actually the financing mechanism of the organization that aims to reduce asymmetries in the bloc. And it is made up of yearly contributions of member states, as well as spontaneous contributions of non-member states and international organizations. And the first batch of this fund was $5.6 million, which was reserved to strengthen the virus diagnostic capacity in the region, with the purchase of equipment, supplies, and kits for rapid detection. And due to the scarcity of PCR kits at the time in May, Mercosur provided an additional fund through Mercosur for the production of PCR kits and other tests in Uruguay. In Central America, SICA has been particularly active compared to other IGOs in the region. So SICA was created in 1991, and its fundamental objective was to bring about integration in Central America as a region of peace, freedom, democracy, and development. And member states include Costa Rica, El Salvador, Guatemala, Nicaragua, and Honduras. And in dealing with the pandemic, SICA was very prompt to design a regional contingency report already in March 2020. And the report covers some very concrete plans to deal with the wider impacts of the pandemic. So it includes actions and measures not only in the areas of health, but also in trade and finance, security, justice, and migration. And in addition, important efforts also include food security, the micro, small, and medium enterprises sector, and also the gender perspective for the protection of women's rights during the pandemic. Noteworthy are also that all these efforts are not only short-term efforts, but are also looking at more medium and long-term effects of the pandemic, and also looking into the recovery phase of the pandemic. The plan furthermore included an emergency fund of 1.9 billion US dollars, which will distribute $1 billion to support central banks, $550 million for fiscal emergencies, and $350 million for a liquidity program for commercial banking in the SICA member countries to support the private sector. What was also very pronounced in SICA's response was the active role of SICA's Council of Ministers of Health. So those are the ministers, a group of ministers of health of the SICA member countries, because they've been having very regular meetings, virtual meetings, since early March. And they also effectuated early coordination efforts, which included examining laboratory protocols and also the strengthening of health offices at borders, so at ports and airports. In collaboration with the WHO, COMISCA also published daily updates on the epidemiological developments in the region. And COMISCA has also received support from the EU for strengthening mental health support and programs for the ministries and secretariats of health of the member states. COMISCA has also participated in other sectors of ministries where they seek solutions for issues not only related to health. So they've also been in touch and shared information, for example, the Council of Ministers for Economic Integration. Compared to Latin America and Africa, the Middle East and Northern Africa is not a region with high levels of regionalism. Active regional organizations include the Arab League and the Gulf Cooperation Council. However, the Arab League does not seem to have pushed any meaningful efforts in response to the COVID-19 crisis. The Gulf Cooperation Council has coordinated efforts, but in this talk, I'll focus on the Organization of Islamic Cooperation. And this organization has a very far reach as it brings together countries with Muslim majorities all over the world. And it's interesting because a common faith as essence of such an organization is rather unique, because usually regional organizations are organized around states with geographical proximity. The OIC has 57 member states. It was created in 1969, first and foremost, to defend and safeguard interests of Muslims worldwide. What's important here is that there are 34 specialized organs within the organization that act in accordance with decisions made during Islamic summits. And it looks like several of these organs have been very instrumental in forming a response to the pandemic. So on the 9th of April, the first virtual meeting on COVID-19 took place, and this meeting was held by the OIC health ministers. Noteworthy during this meeting was the reference to a launch of a $2.3 billion program to support affected member states by targeting both the public and the private sector of the OIC countries. And key efforts include the strengthening of health systems, the funding of national epidemic preparedness plans, provision of social safety nets, disease surveillance, but also the support of private sector activities. And this fund was made available by the Islamic Development Bank Group, the ISDB group. And this group can actually be viewed as the financial arm of the OIC. And it consists of 5 OIC subsidiary organs. And one component of this fund was the Islamic Solidarity Fund, which is responsible for poverty alleviation among the member states. So in April, under the Islamic Solidarity Fund, there was an emergency account opened up to give urgent and short-term assistance to the least developed countries among the OIC member states. And assistance primarily covered needs in the health sector, such as medical protection and prevention devices, laboratory supplies and medicines, masks, beds, etc. And this fund was released in 3 different stages to 3 different groups of least developed countries. As mentioned before, the specialized organs of OIC have been pretty active in forming a response. So, for example, the OIC research organ launched a COVID-19 pandemic database to offer policymakers a tool to guide their efforts, but also to inform the public. The OIC trade organ jointly organized several virtual events on the strategies to strengthen intra-OIC trade and investment. The OIC Institutional Food Security announced a strategy to address food security in the wake of the pandemic, with strategies on national levels as well as regional levels. And the OIC Institution for the Study of Islamic Jurisprudence and Law held a symposium with the participation of prominent Muslim scholars and medical experts to discuss the effects of the pandemic, not only from a medical perspective, but a religious perspective as well. So the symposium reviewed Sharia provisions on isolating confirmed cases, but also safe acts of worship, Ramadan fasting during lockdown, and personal hygiene. The OIC has furthermore launched an awareness campaign in both English and Arabic on several social media platforms to counter fake news, and held meetings with the WHO, the EU, and the UN High Commissioner for Refugees to share information and to discuss common challenges. Overall, these regional organizations have reacted fast, but all in their own way. So, for example, Mercosur mostly focused on short-term on a short-term perspective by launching funds for medical equipment and prioritized trade measures by facilitating the flow of goods and capital, which is in line with its core values and prime reason for existence. It did not look at medium and long-term impacts or recovery measures beyond the health sector, but then again, the Americas is a very dense space for regionalism, so we do not know if other IGOs have taken on this responsibility. Many questions remain on the distribution of responsibilities and tasks in a region where multiple regional organizations are active. So I would suggest that further research needs to be done to what extent regional organizations collaborate to forego duplication efforts and what these collaboration dynamics actually look like. SICA, on the other hand, managed to come up with a very extensive and concrete response as early as March, and its efforts reach far beyond the health sector, and commitments by the country's health ministers to meet periodically means there's a strong political will to engage and integrate responses. The OIC shows a strong solidarity to the Muslim world by pushing its specialized organs to respond in various ways. The access to the large fund enabled by the ISDB group resulted in very specific support to OIC member states' needs. And in addition, the Islamic Solidarity Fund has transferred urgent aid to least developed countries. The OIC has also countered misinformation on online social platforms and is furthermore tapping into its network of local religious leaders to make sure correct and preventive health measures are communicated to the public. As the pandemic and its responses are still evolving, of course, so is our research. But it's just to highlight the efforts by regional organizations in various regions in the world, and to understand its significance in an emergency context where multiple levels of governance are required. Thanks very much for listening, and looking forward to any questions, thoughts, or feedback. Thanks.
Thank you so much to Kathryn and Hannah for sharing those insights. So we are now open for questions and discussion. We invite you to put your question or comment in the chat, or you can use the raise hand function to ask your question directly. And please do turn on your camera if you wish when asking a question. So floor is open.